Welcome to SR PHARMA GYAN. Today we are going to discuss on the metformin. So this is a drug used in the treatment of type 2 diabetes mellitus. Now coming to the history of metformin, metformin derived from the glycine, a natural product obtained from Galanga officinalis. So this is the structure of the glycine and this is the Galanga officinalis. Metformin, it is only one drug available under the Biguanides used for the treatment of type 2 diabetes mellitus. Previously, metformin is used as antidiabetic medication under the biguanide class, but due to the high risk of the lactic acidosis, it was withdrawn from market in the late 1970s. So due to this lactic acidosis, of course, metformin also can show dose dependent lactic acidosis, but it is rare. Metformin, it was discovered in 1922. Human study began in 1950s and introduced into the France in 1957 and in US 1995. This is the general structure of the biguanides. So this is the biguanides class, and metformin, it is the only one drug available under this biguanide which is used for the treatment of type 2 diabetes mellitus. So in short, if we see about this chemistry, generally alkyl substitution and phenyl substitution, clear, alkyl substitution and phenyl substitution of nitrogen R1 and R2, clear, R1 and R2. So these two position, if there is a alkyl and the phenyl substitution, then there is a increase into the activity. So activity is increasing. Substitution with the longer chain, branched chain and cyclic alkyl substitution reduces the activity. So longer chain, branch chain or the cyclic alkyl substitution reduces the activity in the biguanides general structure. Substitution with the alkyl, then phenanthyl gives more potent derivative. Compounds with the hydrogen and methyl substituent, hydrogen and the methyl substituent in the R2 position, clear, R2 position showed the highest potent activity, clear, highest potent activity. And here we can see that there is a substitution into the R1 and R2 in the metformin. Now coming to the mechanism of action. Now metformin, though it is used, and we are mainly focusing, is used considering the diabetes mellitus, but there is a lot of study is going on around the world which shows that metformin may be used for the treatment of the other disease condition also, and there is a lot of mechanism it was there, and different mechanisms still it is unknown, that it is still under the research. But whenever we are talking about the diabetes mellitus, we are going to discuss about this major effect and major mechanism of action when it is acting into the liver, then muscle, GIT and brain. Now what are the major effect of the metformin in relation to the diabetes mellitus in liver? It reduces the fatty acid and the cholesterol synthesis, it is reduces the lipogenesis, increases the insulin sensitivity and reduces the gluconeogenesis. While in muscle, it enhances glucose uptake, it increases the glycogenesis, increases oxidative utilization of glucose. In brain, it is reduces the food intake while acting on the brain, and you can say that reduce the body weight. If you remember that sulfonylurea, whenever we have discussed about the sulfonylurea, we have told that it is sulfonylurea responsible for the weight gain, and that's why it may not be suitable for the obese people. But here metformin is helpful to reduce the body weight. While acting on the GIT, they are helpful to reduce the blood glucose level, enhances the glucose utilization, and also increases the insulin sensitivity. So these are the major effects of the metformin. We'll see the mechanism one by one. So now we'll start the mechanism of action, detailed mechanism of action of metformin in liver. Organic cation transporter member 1 or OCT1, organic cation transporter member 1, mediated uptake, mediated uptake of the metformin in liver is responsible for the inhibition of the complex 1 or mitochondrial respiratory chain complex 1. So metformin, it will enter into the liver through OCT1 and then it will cause the inhibition of mitochondrial respiratory chain 1. It is causing the inhibition. Now due to the inhibition of the complex 1 is responsible for the decrease into the ATP level. So ATP level is reducing and ADP level is increasing. So the ratio between the ATP by ADP, it is reducing, and then AMP, level of AMP, it is increasing. So as a result, as the AMP level is increasing, ATP level is reducing, as a result it will cause the activation of AMPK, activation, activation of AMPK, which is the most important mechanism, which is the most important mechanism of metformin, AMPK or AMP activated protein kinase. So activation of the AMPK, it will cause reduction of the ACC, acetyl-CoA carboxylase, HMG-CoA, beta-hydroxy, beta-methyl glutaryl-CoA, and SREB1, sterol regulatory element binding protein 1. So all those things, ACC, HMG-CoA and SREB, it will be reduced. Now reduction of this, it will responsible for the decrease into the fatty acid and cholesterol synthesis, decrease into the fatty acid and cholesterol synthesis, and decreasing into the lipogenesis, decreasing into the lipogenesis. It also enhances the insulin sensitivity in liver. It also enhances the insulin sensitivity liver. So this altogether very important to maintain the glucose homeostasis. All these things is occurring via increase into the AMP level, decreasing the ATP level, increasing into the ADP level, activation of AMPK, then reduction of the ACC, HMG-CoA, SREB1. As a result, insulin sensitivity in the liver is increasing, decreasing the lipogenesis and decreasing the fatty acid and cholesterol synthesis. Now activation of AMPK also responsible for the increasing of the SIRT1. Now SIRT1, SIRT1 protein is encoded by the SIRT1 gene, and this mechanism is very important to maintain the glucose homeostasis. Then it is responsible for the activation of AMPK, also responsible for the decrease of the phosphoenol pyruvate carboxy kinase, PEPCK, decrease into the PEPCK and glucose 6 phosphatase, glucose 6 phosphatase. Also by activation of AMPK as well as by increase into the AMP level, increase into the AMP level, in turn it is responsible for the decrease of the fructose 1,6 biphosphatase, fructose 1,6 biphosphatase, which in turn, so here directly by increasing to the AMP level as well as by activation of the AMPK, it will cause the decrease into the gluconeogenesis. It is one of the important mechanism of the metformin, how metformin it is controlling the or reducing the blood glucose level. So gluconeogenesis, it will be reduces. So this is the one of the important mechanism through the activation of AMPK. Through the activation of AMPK, it is reducing the gluconeogenesis, it is increasing the insulin sensitivity. Now if we see about the metformin, in the metformin, it is also responsible for inhibition of mitochondrial glycerol phosphate dehydrogenase, mitochondrial glycerol phosphate dehydrogenase, or MGDP. It is a rate limiting enzyme for the glycerol phosphatase redox shuttle. It is a rate limiting enzyme. Clear? It is a rate limiting enzyme of glycerol phosphatase redox shuttle. Now if there is a inhibition of the MGDP by metformin, it will in turn cause the altered hepatocellular redox stage. It will alter the hepatocellular redox stage, as well as conversion of the lactate to pyruvate also it will be inhibited. Conversion of lactate to pyruvate also inhibited. Here it is very important that dihydroxy acetone phosphate. Now due to the inhibition of this MGDP, dihydroxy acetone phosphate, there is a decreased level of the dihydroxy acetone phosphate and reduces the conversion of the lactate to pyruvate. Clear? Lactate to pyruvate. Now if there is a decreased conversion of the lactate to pyruvate, it is reducing, so that it will diminish the utilization of glycerol and lactate. It will diminish the utilization of lactate and glycerol for gluconeogenesis. That means ultimately they are involved into the reduction of the gluconeogenesis. That means through inhibition of the complex 1 and activation of AMPK, it is reducing the gluconeogenesis, as well as inhibition of the MGDP also responsible for the decrease into the gluconeogenesis. And some of the recent study stated that this metformin, by suppressing of MGDP, it is responsible for 30 to 50% suppression of the gluconeogenesis, or the inhibition of the gluconeogenesis, 30 to 50%. So this is also, it is very, very important. So here we can say that metformin, it will act on the liver, increase the insulin sensitivity, reducing the lipogenesis, reducing the fatty acid and cholesterol synthesis, as well as it is also responsible for the inhibition of the gluconeogenesis. Now coming to the effect of the metformin in the intestine. Clear? In the intestine. So in the first mechanism, see, already we have in previous classes we have discussed about the GLP-1, which is a incretin hormone, and it is secreting from the L cell of the intestine. Clear? L cell of the intestine. Now metformin having the direct effect on the GLP-1 release, and through the AMPK dependent pathway, through the AMPK dependent pathway, it will cause the release of the GLP-1 from the L cell. Clear? GLP-1 from the L cell. As a result, and we have seen that GLP-1, it is stimulate the release of the insulin, and it is called the suppress the glucagon. It is called the suppress the glucagon release, and ultimately it is decreasing the blood glucose level. Clear? Decreasing the blood glucose level. So metformin, by releasing the GLP-1, it is decreasing the blood glucose level. Now metformin on the intestine also responsible for the alteration of microbial flora. positive alteration of the microbial flora, like echinacea or Escherichia it will be enhances, and intestinal bacteria it will be reducing. Now this alteration of the microbial flora, it will be useful to maintain the gut health as well as to maintain the glucose homeostasis. Now due to this alteration of the microbial flora, it will affect on the glucose utilization and bile acid metabolism. Clear? It will be affecting on the glucose utilization and bile acid metabolism, which in turn useful into the maintenance of glucose homeostasis. Clear? Maintenance of the glucose homeostasis. Now this alteration of the microbial flora, it is also important for the maintaining of the intestinal barrier integrity. Clear? Intestinal barrier integrity. Now it will cause the promotion of HCFA, that means short chain fatty acid. Clear? Short chain fatty acid production. Now these short chain fatty acid are the fatty acid with fewer than 6 carbon atom. Clear? With fewer than the carbon atom, and you can say that it is derived from the microbial fermentation of food we are taking. Clear? Microbial fermentation of the food, and it is one of the important source of the energy, and it is very important to maintain the gastrointestinal health. Clear? Gastrointestinal health. So these are the effect of the metformin on intestine. Then coming to the metformin effect on the muscle. Clear? Muscle. In the muscle also it will cause the activation of AMPK. It will cause the activation of the AMPK. Now in the muscle, when they will cause the activation of the AMPK, it is responsible for the glucose uptake. It is responsible for the glycogenesis and increase the oxidative utilization of the glucose. So glucose uptake is increasing, glycogenesis is increasing, and oxidative utilization of the glucose is increasing. So this will turn helpful into the lowering the blood glucose level. Clear? Blood glucose level. So these are the important effect of the metformin in muscle. While in brain, clear, in brain or the in CNS, when it will act on the hypothalamus, clear, hypothalamus, it will cause the inhibition of AMPK. Now in all other cases like muscle, liver, we have seen that metformin cause the activation of the AMPK, but in the hypothalamus it will cause the inhibition of the AMPK. Clear? In the inhibition of the AMPK, as a result there is a decrease into the neuropeptide level. Clear? Decrease into the neuropeptide level, so that food intake and body weight, clear, food intake and body weight, it will be reduced. And this is one of the major mechanism of the metformin. Again, see, metformin, we have told that they are reducing the body weight. Clear? Reducing the body weight. So here we can find that by inhibition of the AMPK, it will decreasing the food intake and reduce the body weight. So this is all about the different mechanism of metformin. Now coming to the pharmacokinetic profile. So it is absorbed mainly from the small intestine, bioavailability 40 to 60%, plasma T-half 2 to 5 hours, plasma T-half is 2 to 5 hours. It is not binding with the plasma protein, so this is important, is not bind to the plasma protein. Excreted through urine in unchanged form, excreted through urine in unchanged form, and nearly 90% of the drug eliminated from the body within 12 hours. Clear? Within 12 hours it is eliminated from the body. Now uses, if we are talking about the uses, it is used as a monotherapy because it is one of the first line drug, as we have told that this is the first line drug for the type 2 diabetes mellitus. So it is used into the pre-diabetes condition also, it can be used. It can be used into the gestational diabetes also, and also with the type 2 diabetes mellitus, where it is the first line drug. Clear? First line drug. Now it was seen that with this type of the drug, metformin also improves the pancreatic beta cell function. So it is improve the beta cell function. It is increasing the beta cell function. So how it is increasing? So metformin reduces the compensatory pancreatic beta cell hyperplasia. Clear? Compensatory pancreatic beta cell hyperplasia. It is reduces. Then metformin protect beta cell. Protect beta cell. It is protecting. Protecting beta cell. Beta cell protect against glucotoxicity. Against glucotoxicity. Glucotoxicity induced by the oxidative and ER stress. Then metformin improve chronic exposure of the fatty acid induced pancreatic beta cell dysfunction. So it is improve beta cell dysfunction. So if there is a chronic exposure of the fatty acid is there, then there is a beta cell dysfunction is there, which will be improved by the metformin. Other than the diabetes, this drug also used into the several other conditions. For example, cancer. So cancer. Now it was seen that metformin, different preclinical trials, mainly evidence indicated that the metformin inhibit the growth, survival and metastasis of the different type of the tumor cell, like you can say that breast, liver, bone, pancreas, endometrial, colorectal, kidney, lungs cancer. So it is in those cancer, in different category of the cancer, metformin inhibits the growth, survival and metastasis of the tumor cell. Obesity, it is very useful for the obesity. Already we have seen that metformin, it is act onto the brain, it is cause the inhibition of the AMPK, it is inhibition of the neuropeptide, and they will inhibit the weight gain. They reduce the weight gain and the food intake. So they are useful in the obesity condition also. Then coming to the liver disease. Now metformin activate AMPK, modify apoprotein that is apoprotein residue or the apolipoprotein residue. Then it is increasing or you can say that prevented the dysfunction of the HDL, reduce the LDL modification, improve cholesterol transport. So all these cases we can find that it is also useful, also useful in the liver disease, Next is renal disease. So by utilization of the glucose utilization, decrease the cell inflammation and the oxidative stress, because metformin again it is very useful to reduce the inflammation and oxidative stress. So they are also helpful into the renal disease condition also. Then cardiovascular protective effect. Now this metformin, they are helpful into the atherosclerosis. That means they are having the anti-atherosclerotic effect. Then vascular endothelial protection, they are conferring, they are providing the vascular endothelial protection. Then they are improve the lipid profile. Already in the liver disease also we have told that. And it was seen that different, mainly the preclinical studies indicated that type 2 diabetes is associated with the different cardiovascular complication. For example, you can say that myocardial infarction, hypertrophy, diabetic cardiomyopathy, etc. etc. In those conditions, metformin, it is useful and confer the cardioprotective effect. Next is HIV associated diabetes also. It is very helpful. Then polycystic ovary syndrome, which is a hormonal disorder, and it is common among the women in the reproductive age, and in such condition you can say that insulin resistance is increasing. So there also metformin is useful. Neuroprotective effect, so it is improving the conjunctive function, reduce the incidence of the dementia in the patient with the type 2 diabetes mellitus. So it is conferring the neuroprotective effect, suppresses the inflammation. Already we have told that it is very useful to suppress the inflammation. Anti-aging effect, it is also conferring the anti-aging effect and antioxidants effect. Clear? It is also antioxidant effect it is conferring, so that it is suppressing the obesity induced the inflammation into the different organ like liver, macrophage. Then you can say that adipocyte inflammation also it is reduces. So these are the different effect of the metformin. Now coming to the side effect, generally lactic acidosis, but rare, which is dose related. GIT side effect, diarrhea, stomach upset, nausea, vomiting, abdominal bloating, gas, reduced appetite, weakness, and metallic taste. So these are the GIT related side effect. Allergic reaction to this drug is generally it is rare, and long-term use, clear, long-term use may cause the vitamin B12 deficiency. So these are the side effect of the metformin. And if we are talking about the contraindication, generally renal function impairment, hypersensitivity, it is considered. Chronic heart failure, congestive heart failure like, or the respiratory insufficiency, liver disease, alcohol abuse, metabolic acidosis, severe infections. In such cases it may be contraindication, it is there, clear, contraindication it was observed. So this is all about the metformin. In this lecture we have tried to discuss the metformin in details in light of the different current research which is going on the metformin. So these are the attribution and some of the references. So we'll end up today's lecture with the great thought of Homi J. Bhabha. My success will not depend on what A or B thinks of me. My success will be what I make of my work. Thank you once again. Thank you one and all.